Good morning, everyone. Thanks for joining us. We're really excited to be able to talk with you today about the PolicyMap Fund for Healthy Rhode Island application that we're able to make available to you. This is Katie Murray. I'm Director of Evaluation and Learning here at the Rhode Island Foundation. I'm here joined on the phone with Larry Warner, the Strategic Initiatives Officer.
Hello, I'm glad that everyone was able to participate in the webinar or view it. Thank you. I look forward to hearing about the tool.
Great, thank you. We have had a relationship with PolicyMap for almost a year now and subscribed last spring. And through the subscription, we've been able to build out special applications for a number of different projects. This Fund for Healthy Rhode Island is the most robust one that we've built yet. And we're really fortunate today to be joined by Taylor Harrington, who's the Data Services Analyst at PolicyMap. And she really was my lead contact at PolicyMap in building out the application, pulling in the data, figuring out the different elements that we wanted to make available. And she's actually going to be able to lead the majority of the training in the beginning, being the PolicyMap expert. So Taylor, I will turn it over to you. And you can lead us through PolicyMap, the application, and we will have time for questions, and I'll join back in later with a few other thoughts from the Rhode Island Foundation.
Sounds great. Thank you, Katie. Well, firstly, I just want to check on some logistics for those of us who are joining here today. Can everyone see my screen and hear me okay? So thank you again for the intro, Katie. Again, my name is Taylor, and I work here at PolicyMap as a data analyst. I'll be leading the training today, and if you guys have questions as I'm going over some of the site mapping tools and functionality that we provide, feel free to jump in. I'm going to start with some quick background and just on PolicyMap and our platform, as well as our origins from a nonprofit CDFI in Philadelphia. So as you guys may know, if you've explored the site a bit, we are a nationwide mapping and data platform. We host nearly 40,000 indicators from public and proprietary data sources, which we make available in an easy-to-use mapping and reporting tool. Our data covers topics such as demographics, health, income, housing, education, jobs, and more. And we are often used for research, market studies, business planning, site selection, and grant applications. Our subscribers include all levels of government, university systems, nonprofits, and CDFIs, as well as commercial lending and real estate firms. We started in 2008 as part of the Reinvestment Fund, which is a nonprofit CDFI based here in Philadelphia. And through our relationship with them, we maintain a commitment to equitable community development and open data in the work that we do. So I will start this training with some information about what is available through our site as a whole, and then get a little more in depth into what has been provided to you as grantees through your partnership with the Rhode Island Foundation. And some context to our site, even though you guys are not direct subscribers and you have kind of access to a portion of PolicyMap, you individually can also go in and create a free login, which will create a free subscription for you, and you can have access to the majority of the functions that I'm going to be showing you today. To start off, this is our main login page, if you can see on my screen that I'm sharing. So when you go to policymap.com, this is what you'll be brought to. The first thing I want to point out to you, which can be really helpful to you as users, is this support drop-down. This takes you to our support page. We have weekly trainings that are very similar to this one, though a little bit less specific to your use case. We have tutorials on tables, maps, understanding the data that we have provided. Again, here's some training calendars, frequently asked questions, and a video gallery that you may find useful. So that's under our support page. That's a good place to start. Towards the end of this conversation, Katie and I will also be sharing our information. And if you have any questions throughout your use of PolicyMap, you can feel free to call or email me and use me as a resource as well. So getting into PolicyMap and kind of the main use of our site, I'll bring you to our main maps page. And when you log in, once you create a free subscription, you'll be brought to this page. This should be quite familiar to you looking at maps and data, but I'll share some organization of the data that we have. All of our data is housed in these categories along the top gray bar. So as you can see, they're organized by demographics, incomes and spending, housing, lending, quality of life, all the way through health, federal guidelines, analytics. I'll show you what one of our data menus looks like and how they're organized. To the left, we have layers of data. So this is any data that's going to shade the map or be aggregated to particular geographies. You can see things like health status, risk factors, access to food and grocery retail. And on the right of all of our menus, you're going to see data points. And these are coordinate locations of any kind of point level data. So here you'll see, for example, the actual locations of farmers markets versus a more shaded or layered indicator. So all of our data is separated by either indicators on the left or data points on the right. When you are first on our map, you can search for data by either type, so you can look for a particular data set and select it, adding it to your map. You could also search by location. And this will bring you to any geography that you're searching for in our location bar. We also have a new feature as part of our location bar. Excuse me, I'm having a technical issue. Where you can search not only by a particular location or address, but you can specify different districts, legislative districts, block groups, or census tracts. So if you wanted to go to congressional districts in Rhode Island, you can just use the drop-down box to access that data, to access those boundaries. Towards the right upper hand corner of your map page, you're going to have other kind of resources for you inside and outside of the tool. As you can see, anything that you create with part of your free subscription, you can print the map, you can download data when available to you. You can also share maps. This creates a short link, so you can share it internally or externally using this share button. And we also have for subscribers the option to save your work in kind of a platform folder structure. So here, when I pull up my saved work, you can see you can save any of these tools that you've created, your custom regions or data, the data that you've downloaded. And this exists as kind of just a file structure available to you. It's not going to have consistently updated data sources. By that I mean it doesn't exist like a Google Maps that's a Google Drive that's consistently updating. So this is a static folder system for you. I wanted to point out as well, during your use of the site, we also have map boundaries down at the bottom. These are any of the boundaries that you might want to layer on your map. We do have some local boundaries, but I don't believe we have any in Rhode Island right now, so they can be added. But if you wanted to see the boundaries of counties, for example, those are going to exist in this bottom right map boundaries. Just like any other map, we have the zoom level shown here on this bar. You can either use your mouse scroller or this bar plus and minus to zoom in and out of the map. Here we can see the counties and their labels are provided down here in the map boundaries. All of our data, when it's added to the map, will also come with a legend. This example for farmers markets, I can explain to you how the legend is organized. We have the name of the data set, the source, by clicking the source, you will be brought to our data directory, and this gives you kind of in-depth information on the source of the data, any manipulation that PolicyMap did, whether it's available to subscribers only or to free users, the geographies at which it's available, as well as the years available. So for this one, there's a bit of a description, but every data set that we have on PolicyMap has a page just like this for you to find out whatever information you'd like. This particular data set also has filters, so some of the attributes that are associated with farmers market, you can filter to just see a subset of that data, or you can color code it to see kind of the spread and distribution of your data. So if you wanted to see only farmers markets that accept SNAP, you can select accept SNAP, and then only the ones that are accepting SNAP will be now populating on your map. And this filter is shown right down here. You can also remove that. I'm going to show you what an indicator looks like and how to understand the legend for that. If you wanted to look at a health indicator, let's say life expectancy at birth, I wanted to point out a few things to you. First of all, this legend as well. You can see this is a new data set recently released from the CDC, so we only have it for the current estimates, 2010 to 2015. But some data sets that we update consistently, we will maintain previous years to start to see historical trends. So you can use this drop down to select previous years of the data. Similarly, some of them will not only have years, but they might have variables like percentage or percent change. So you can select different variables of the same indicator by using this legend option. This shaded by is describing the geography at which the data is currently aggregated. For a lot of our data, this will change depending on your zoom level. So if you're zoomed all the way into the city and you're at the level of census tracts or census block groups, the data automatically re-aggregates to those. But you can also select in this drop down when it's available, shaded by, and you'll see, I want to see this by county or by census tract or by state, for example. Similarly, you have the option in your free use of PolicyMap to change the colors of the display, to change the ranges available. Currently, at each aggregation level, all of the data breaks out into quintiles, so they're not necessarily by the spread of the data that you're looking at, but by the spread of the data as a whole, the data as it exists for that geography. So you may want to play around with the spread of data when you're looking at a smaller geography. You can change the number of ranges. You can also just edit the numbers, and the ranges will recalculate for you. Does anyone have any questions so far about kind of the main functions of PolicyMap and the maps available to you?
Is there any sort of visual of any of these? Let's say there's a low life expectancy rate in a particular census tract in Providence or in a particular area of Rhode Island. Is there like a bar that will kind of shoot up in that area, or do you have some kind of visual?
I'm getting some feedback on that phone. Yeah, so right now the colors are displaying the density of the data. So we're looking at life expectancy. This variable happens to be in years. And so what might be interesting to you is if you're looking at our tables function. So we do have the ability to build tables with a subscription and to see a little bit more of maybe what you're asking about, the visual of kind of how strikingly different one geography might be from another. So other than the tables function, on the maps, we don't have any kind of 3D display or anything like that. It's more of the color shading to show that difference. I'll pull up, let's see, population density, and you can start to see that clearly as well. But we don't have like a 3D bar chart or anything.
Okay, thank you.
One more thing to point out about the data sources. I did show you where you can select on the source and be brought to our data directory. There's also additional information right here in the title. When you push the drop-down box right here, you will see a little bit more information about the source of the data and the years available, et cetera. So those are kind of the basics of understanding where our data is housed, how to find data. Again, if you don't know what category you want to look in, you can also use this find. Again, just search by topic, home sales, poverty, and you can search for data sets that way. We also, depending on the kind of work you guys are doing in your communities, this is kind of useful for understanding land use in your community as well. If you wanted to look at the satellite alongside, we have data layerable with a satellite view of your community, and that moves just as the map moves. Something to know about there. Any other questions right now? Okay. So there are some higher level functions that are only available to subscribers. Paid subscribers. So I wanted to give you guys a little bit of context before we switch over to the widget. So this is PolicyMap proper that I've showed you, and this has all 40,000 of our indicators. Every data set that we have exists right here on this site. 99% of those are available to free subscribers. The only things that are not available to free subscribers are those data sets that we are prohibited from sharing with non-paid users due to our proprietary contracts, as well as some of the higher level functions, report generation, and using our 3-layer maps. But there are some workarounds for that as well, depending on the work that you'd like to do with Rhode Island Foundation. So we can get you access to most things that you see here on PolicyMap. And the context for that then is we have built, and Katie will talk about this a little bit more as well, but we've built a widget for your use of PolicyMap with the Rhode Island Foundation. And the way that we think about widgets are kind of like PolicyMap light. So really specific data that's targeted and tailored to your interests and your need. It kind of cleans it up a little bit. It's a little bit more streamlined functioning, and it's a public facing access to the site. So there's no logins required. There's no subscriptions required, and it can be shared. The link can be shared with whomever you'd like. And so that was created as a streamlined version of all of the health and demographic information and data that you may need in your upcoming projects. So, and that's just to be clear about the difference between a subscription, which brings you to this page, and the widget, which we will move to next.
Can I ask one more quick question about, you mentioned that you have trend data sometimes. Is that available graph as well?
I'm sorry, I didn't hear it.
Oh, you mentioned that you have year-over-year trend data. Is that available in a graphing function as well? Like, can you get a report where it graphs the trend?
We do. So we have reports, and they are generated. You can do a report on the area of interest. We don't show like trends over time necessarily. We don't do projections, but we do have data historically. When it's available, you can show it on one of these reports. I'm sorry, I'm having terrible feedback from someone's phone. If someone has both speaker and computer audio on, maybe. Is anyone else hearing that?
Yeah, we did it. It just quieted, so maybe somebody.
Okay. I'm sorry about that.
I think if you have your phone and your computer on at the same time, it'll give feedback.
Correct. Yeah. Excuse me. And so that's the report. So I hope I answered your question. Our platform is not designed for, historical trends many, many years back, and we don't do projections as part of our analysis. We just show data in its original form. So sometimes that lends itself to historical comparisons, and sometimes it does not. It's also limited, of course, by data and data releases, and it depends on the data set in particular. But that kind of information, when you want to compare year by year, you can use our tables or the reports as well. The reports do change over time for things like our community profile, health report. We also have some housing and Mortgage Disclosure Act reporting as well. Are there any other questions before we move on to the widget? Okay. So I'm going to show you now, before turning over to Katie for a little more context, I will show you the widget that has been built for you and for your use by the Rhode Island Foundation. So again, just to clarify the difference between this widget and the main PolicyMap site, this widget has been designed specifically with your needs and projects in mind, layering data on this map that is most targeted to you and your needs. It does not have all 40,000 data indicators that we have on our main site, although if you guys determine there's data that you need on here that you don't see, we can still add and change that depending on your needs. So I believe Katie has shared the short link and a bit of a training document with you all, but when you first enter your widget, go to the short link, this is the main page that you're brought to. This is kind of the default. We've built polygons outlining the boundaries of each of your project areas, and that's the first thing that you'll see when you log onto this widget. As you can see on the right, they all exist in the legend currently, and they all have these coordinates that when you select them, you will see the project name, your organization name, and the description that you've provided of your project. So this is the main site. When you first log in, this is what shows up by default. The organization of a widget is slightly different than the main site. Rather than having all of the categorical data sources across the top, we have in this new map section where you can add, change, or remove data from your site, from the widget. And they're similarly organized, but it's just a subset of the data that's most applicable to you. Again, we have demographics data from population by race, different indices that have been developed either here at PolicyMap or by the census of diversity and the tile index as well. Data on incomes and spending is available here to you, and these are cascading menus. So when you see this, you can select and go to another layer. So you can see, for example, median household income by race or ethnicity, and this will layer only for the state of for the state of Rhode Island. Just as in the main site, any of the data that you're layering onto your map will also come with information about the data right here, what kind of manipulation may have been done to it, and when it's available. Similarly to the main site, you can shade by different geographic area, state, metro area, all the way down to zip codes and census tracts. As you notice, census tract is grayed out in this current example. When we zoom in further and they become visible, that will be allowed as an option to shade by as well. and so on and so forth. So you can see the rest of the data is organized into housing, quality of life, economy, and health categories. We also have custom boundaries for your projects that have been layered into the map. So you can select right here and see these as actual boundaries if you have a particular zip code in mind. This legend over here is slightly different than our main site. I'll explain some differences with that. The legend will all exist at once for everything layered on your map, whether that be points or indicators. You can change the colors. The ranges are not editable on the widget. And here, as I was giving an example previously, you can select previous years. So this is median income for white families as of the 2008-2012 estimate from ACS. Here, rather than dollars, you can also see % change, and these are being shaded currently by county, as you can see. So I'm going to show a few data sets in particular that have been chosen for your map and give you a little bit of context in how to understand them and see them also as part of the legend. So I'm going to go to the health data, which is right here in the health category under the new map. And let's say we want to see something about rates of diabetes in the state. So we can go to chronic conditions and select diabetes. The first thing that I'll point out, I know we've touched on with other data sets, but when you first select it, we are panned out quite far to see most of the state. And so the data shows up as county averages only. When we zoom into a smaller geography, as mentioned, that will start to be visible at smaller geographies. So let's say we are going to the city of Providence, and you can see the geographic level of aggregation has changed. So now we're viewing this estimated % of adults ever diagnosed with diabetes as of 2013. We're now seeing that by census tract because we've zoomed in far enough for that to become useful data. And similarly, you can still see the ranges right here, the source availability, and you can play around with the variables and colors as you'd like. Let's see. The location bar exists just as it does on the main site. You can search by particular districts or locations. You can also type in addresses, counties, cities, states. This is slightly different. We only have the print option currently for widgets. So if you wanted to see or download other data, you'll need to use your free subscription in the main site. As part of your widget, Rhode Island Foundation also had the opportunity to provide custom data or data that's only available in Rhode Island that we don't have as part of our main site. And so we've added some examples of that to your widget that are now available to you. One of them is sourced from your state's health department, and that is overdose deaths in the state. So I will select and show you that custom data, which again is only available to you in this widget. These examples where a geography is grayed out either means insufficient data, or in this case, there was some data suppression for geographies that had fewer than 5 overdose deaths. And that kind of information, if you're curious about any of the data, will also exist in the data description. So there'll be a little bit of a write-up as to why certain geographies are showing up as insufficient data, or what was done to suppress data for privacy or anonymity as well. And this data set, as it was provided by the Rhode Island Department of Health, it has only been calculated at the municipality or county subdivision level. So something like this is not going to have different geographies when you zoom in, simply because the data only exists and has only been calculated at the one level. Are there any questions about using the widget or understanding the differences between the widget and the main subscription right now? Okay. So I'm going to zoom back out. Again, slightly different than the main site. The zoom option is on the left here, so we can see the state. So as I mentioned, with the data chosen for your widget, some decisions were made about what might be most useful to you, contextual data on social and health determinants. Let's see, so one, for example, that was added was median income. So we can see that in the incomes and spending menu. Here's median household income shown currently by zip code tabulation area. And this goes all the way down to the block group level, which is the most granular census geography, the most granular geography at which any census data is calculated or gathered. And we can search for a different area here, Newport, Rhode Island, and start to see block group level data as you zoom in. So this is now shown as a block group, which is extremely granular, so you can start to see household income and how that changes block to block in your community as well. When you select any geography of this data, all of the information and contextual information is going to be available to you in this kind of pop-up info bubble, we call it. So here, as we've selected median household income, you can see when selected, this is the data point existing for that geography. So for this block group, which is 406.2 in Newport, Rhode Island, the median household income right here is $26,134. You can start to see the geographic context to that. So within the larger census tract that it exists in, you can see that that's a big jump. The census tract as a whole has a median income per household of over $62,000. When you get to the zip code, the county subdivision, the county, you can start to see that context as well, all the way up to the United States, which is the largest geography, of course, that we host on our site. So these kinds of things can be helpful for context when looking at your particular areas of interest. Again, I zoomed into Rhode Island. You can see the project boundary right here in blue, which is outlined for you. I wanted to find a point data set as well to give you a little more information on what you can find by looking at our point data. So here I've layered a point data set chosen for you, provided for you on LIHTC developments in your communities. So here's an info bubble that pops up when you select any of our point data. So any of the attributes that we have related to any of our data sets are going to be available in these, what we call info bubbles. So some of them are pretty standard. You are going to want to know about the project name, the HUD ID, the address. It also has some contextual information. Is this in a difficult development area? Is it in a qualified census tract? These are HUD limitations for LIHTC funding. Details about the project or about any point, might want to see the number of rooms and their construction type, total unit, what year the funding was allocated, and what kind of populations are targeted for each community. So any of the point data sets will have info bubbles just like this with all of the attributes, and all of the indicator data sets, which are the layers, will have this contextual information to start to display a little bit more clearly where this data exists and within the larger geography. Are there any questions arising just yet? We have as much time as you guys need. If there's any specific questions or want me to show any particular data or uses of the tool or the main site.
You mentioned overlapping diabetes and race. I didn't maybe how you did that, where you used two different indicators.
I'm sorry, I didn't hear you.
You mentioned mapping race and diabetes. Maybe I missed. I didn't see how you were able to choose different indicators.
We don't have data on diabetes by race.
Sorry, I said that.
Yeah, that would be really interesting. We have some health data that is categorized by race, but a lot of it is not through the CDC. That's just not tabulated like that, unfortunately. So I just went to the new map, which is where we add and remove data, selected diabetes under chronic conditions. So here is what I had showed before, which is the rates of diagnosis of diabetes. But yeah, we do not have that separated by racial category. We do have the kinds of things, what we do, if you want to see demographics, then population by race, and if you wanted to see population by race, then you can start to compare these. I didn't show you in the main site because it's not currently a function available to free subscribers, but we do have something called 3-layer map, and just like it sounds, it starts to, you can layer different indicators and then only show geographies where all the stipulations are met. So if you wanted to see, I want to see where diagnosis rates of diabetes are above 40% and where the non-white population is over 30%. You can start to kind of dig down the data that way. So depending on the needs of your projects, that's something that I could perhaps develop for you and share with you if you have specific questions. But otherwise, that'll be a comparison of two different data layers.
Thank you.
Yeah, absolutely. Any other questions right now? Okay. Katie, do you feel it's a good time to jump in and give a bit more context in your project and choosing this widget?
Yeah, this is great. And if more questions come up, I think we'll still have time at the end. Taylor, that's incredibly helpful. Thank you for walking us through the functionality. As Taylor said, she will share her contact information. You all have my contact information. I know our application better than the whole PolicyMap application, so I do appreciate, Taylor, you're making your contact information available. So to just provide a little bit of context on why we did this, and I wanted you to see the functionality before I went to a bit of a higher level discussion. Having worked with secondary data for many years of my work career, the PolicyMap functionality is a pretty incredible resource that brings so many data points that you might otherwise need to access census or the Kaiser Family Foundation or the Rhode Island Department of Health or Rhode Island Kids Count, so many other sources to try to start looking at data across these different sectors. They bring it all into one place. So that's first the piece that's really important here. And secondly is bringing it down to a geographic level that we think is really important for the work you're doing. For all of the projects, we know that there are census tracts and block groups and incredible variation within project areas that are really important for you to understand the population, for you to think about interventions, to track change over time. And PolicyMap has the functionality not only to help you track those data, but to really look at what's happening in communities at a level that otherwise you can't get from sources such as Robert Wood Johnson Foundation county health data. They have great indicators, but it's all at the county level. And even locally here, there are great sources, but oftentimes only at a municipal level. So that's the first thing. You know geography matters. You know your communities well. You know the population. So this is to help fill in some gaps in your understanding or data gaps in needs assessment. The census tracts, like Taylor mentioned, typically are ideally have about 4,000 population, block groups about 1,500, and there is some variation depending on the exact census tract and block group. But that's the level at which you're talking here. It's really small numbers of individuals. Secondly is the idea of establishing a baseline and tracking change over time. A few of the data that Taylor demonstrated, such as from census, already have some of the change built into the functionality of the layer. And as new data become available, PolicyMap is committed to keeping their data updated. So we know in another year or so, we will be involved in the Census 2020. Some of those data could be available during this project time. And so this is going to be a source from which you don't need to go to census.gov and start trying to search for census tracts that are of interest to your project. The data will be updated here. And so you can look at baseline data now and then look at change over time. So we're trying to think of ways to make data access more easy for everyone and in one location. And then finally, we've really appreciated the work that we've done with PolicyMap over the year, and we wanted the partners in the Fund for Healthy Project Areas to be able to help to benefit from the subscription. So even holding this webinar with PolicyMap and Taylor making herself available for questions is really extraordinary and something that we can help bring to you all. So we hope that you'll find this application, the widget, as we call it, useful. And I thought it was really important for Taylor to show the bigger PolicyMap tool because, like she said, we couldn't bring in all of the indicators. We didn't want to overwhelm. We didn't want to clutter the initial rollout of this application. But there might be data sets that we didn't bring in that you think are really important. So now you, as you get to know how to use our application, you'll be more able to use PolicyMap and to be able to go into the full application and look at other data sets that might be useful. And as Taylor said, we are open to adding more data to our widget. And we would, I think one lens we want you to have is data sets that might be relevant to you and could have implications for other projects, because we want to try to keep it streamlined as we can and not get it to be such an overwhelming amount of data that people aren't feeling comfortable using it and are a little looking at too much when they log in there. But we are certainly open to adding more data and to uploading data sets from Rhode Island that are not available on PolicyMap. So please let us know if there are any that come to mind. And I think that's it. I don't know if there are any questions from participants to the call on any of my comments, or Taylor, if you want to add anything.
Mm-hmm. I'll jump in really quick just to add one note on your continually updated census point. Something to point out, if you notice, all of the census data that I was showing today is shown at the ACS estimates of 2013 to 2017, just to illustrate the turnaround that we have on a lot of this data. So that was released December 6th of this year for the current estimates, and we had it up on our main site and pushed through to all of our tools by that Monday, the 10th. So it's like a really quick turnaround that we do to make this data accessible to you. And anytime that you guys hear of new data or data updates coming out from federal or state agencies, we kind of have our finger on the pulse too and try to have that to you as soon as possible. Just as Katie was saying, to streamline that process. I know going through FactFinder and American Community Survey can really be a hassle sometimes. So the idea of this is just to make it accessible, understandable, and clearly visible to our users. So just kind of following up on that point that we update our data continuously and always try to have it as close to current as possible.
Thank you.
But yeah, absolutely. But just echoing once again, if there are any questions, feel free to jump in.
Another question, but I'm going to wait because I've been a lot of questions. If someone else has one.
No, probably go ahead, Julie.
Thanks. This is great. Obviously, a you. So, great. I have been having to follow the census data, deal with that, and this is wonderful. I was just wondering how just to look through your functionality, any of the reports that you provide found are particularly compelling for audience. One of the things is, is trying to present data to really present in a way that really helps feel it, be engaged with it. You've got different reports and reports. I just haven't had a chance to look at any that you find are particularly compelling, folks, when looking.
I'm so sorry. I'm catching some of that, but I didn't hear your whole question. Do you know if you have both computer and phone audio going?
I have my phone just out, and so it's off. Hear me better now?
I think so. Yeah. I'm so sorry. Could you repeat the question?
Yeah, sorry, a bit long-winded, but I hadn't gotten a chance to go through the reporting yet. One of the things that we go with, we're trying to get things that we can communities when we're reporting out data, having reports really compelling and help people really feel the issue. I'm wondering if you would point us to or report that you think are pretty good in really highlighting it. I know you have a whole section, I just haven't looked through it. I don't know if you have any thoughts on that.
I hope that I'm hearing you correctly. I think, were you just asking about kind of what reports we have available and what might be most useful to you?
Which ones people tend to engage with that are exciting? It's funny how people can engage with data when they see a picture.
Absolutely.
What you're, obviously looked a lot at the map, and you briefly sort of showed us the bar graph. If you had other, you might, people tend to find these really helpful. I'll be looking for them on my own, but just that I know.
Yeah. Again, I hope that I'm answering your question. One thing that we are really excited about that will especially be relevant to you, I'm imagining, is in early 2019, we have done a complete overhaul of what we call our community health report. And that's been really exciting. There's been a lot of new data sources and indicators coming out from the CDC this year. I showed you the life expectancy data. There's also a lot of data on opioid-related indicators. So we are overhauling our community health report. It will be ready and available to subscribers in early 2019. We're really hoping in January. We're in the final kind of testing processes now. And that is exciting for a number of reasons, not just the new data sources, which have been really engaging to our clients, but we also have re-aggregated data in the community health report to be available at really small geographies, which is kind of hard to find in the health sphere. So we're really excited about that. A lot of data that we can now find at the census tract and municipality level, which was previously only available to counties or in some cases states. So that's something to look out for, and I can make sure when that's ready for Katie to be in touch with you all as well, because I think that's something that would be useful in your work. And in addition to that, the main community profile report is really helpful for any kind of impact analysis, grant applications, or kind of getting a picture of your project area currently, maybe a picture of your project area in the next year or so. And that has kind of basic information on demographics, income, ages, and a little bit about the economy and workforce in the community as well.
Taylor, there's the also the Opportunity 360 reports that enterprise community has worked with you all on creating that I can reference. I think that's a really good example of some use of the data in a report form. I will send the link to Opportunity 360 to everyone in the follow-up with this webinar and the intro guide one more time. But what enterprise community did with PolicyMap is create reports that are looking at indices of housing stability, education, health, and well-being at a census tract level. And actually, if you open the map of Opportunity 360, click on any census tract, you will get this aggregated data about that tract across several different sector areas and kind of at an indice level. So that, Julie, might be another response of the way that reporting has used the data, but in a much more robust way than we're able to right now with the mapping, but kind of what the capability is.
Yeah, those are great and valuable resources. One thing that I touched on, but speaking to this reporting and kind of engagement with the data question, that I might want to highlight once more. This is not a function available in your widget, but it is available if you create a subscription on our main site. All of the data, the majority of data, I'll say, is available for download at any geography. So depending on your needs, your reporting style or needs, if you wanted to bring this into your own applications to play with the data, to visualize the data, we make it available to you so you can use it both within and outside of our platform as well. So just really quickly, that looks like this. Download data, you can select what data, you can select what location. This would just be just like location bar. And you download it, and you receive the download in a CSV format, which is useful in Excel. You can do data visualization. If you have access to GIS, you could play around with it in there as well. Just to reiterate, the data is available for you to do whatever kind of analysis you'd like with it.
Well, I don't know if there are any more questions. We are coming up on 12 o'clock, and I want to stay aware of everyone's time. So if Larry or Taylor, if there's any final comments you want to add, if not, we will make contact information for Taylor and myself available. And I will definitely send a follow-up to project leads and people who I know are on this call. I can't see everyone who is on this call, but some names I can. We'll be sure to send you the audio and some reference links that we've talked about and the information guide.
Perfect.
I just want to say, this is Larry. I just want to say thank you, Taylor and Katie, for the overview of PolicyMap and the Fund for Healthy Rhode Island widget today. To all of the participants, if you have any questions afterwards, like Katie and Taylor said, feel free to email. Also, if you have suggestions about data points or topics that are relevant to your specific work, feel free to suggest those to us, either if you have specific data sources in mind, or we can maybe call the available data and incorporate them into the widget so they're in one place for you. So that's all I have. Thank you very much.
Great. Thank you, everyone, for your time today. I really appreciate making yourself available. And yeah, we're here if you have any questions.